Do you think human beings can grow extra organs? If that is possible, how would that feel like? Would it be nice or your worst nightmare? Let's find out together in this video where women grow uterus-like or womb-like tissues in places they should not be. If you are new here, welcome to the best health channel on YouTube, where we talk about everything health. This biological process, wait, is it biological? It should be pathological. Just kidding. So this pathological process is called endometriosis. We will talk about what it is, how it happens, the causes and the symptoms. What is endometriosis? Endometriosis is a gynecological condition characterized by the presence of endometrial-like tissue outside the uterus, which induces a chronic inflammatory reaction. This ectopic endometrial tissue, histologically similar to the lining of the uterus, commonly implants on the ovaries, the posterior cul-de-sac, the broad and uterosacral ligaments, and the pelvic peritoneum. However, it can occasionally be found in more distant locations, including the bowel, bladder, and in rare cases, extrapelvic sites like the lungs and brain. For those that don't understand that explanation. Alright, imagine inside the tummy of a girl, right where the womb, uterus, is, there's a special lining that grows every month. This lining is usually only inside the womb. But in endometriosis, this lining starts growing outside the womb too, like on the ovaries, where the eggs are stored, and other areas near the abdomen. It's a bit like if the grass in your garden started growing in places it shouldn't, like on the sidewalk or in the flower beds. Each month, when the girl has her period, this lining breaks down and bleeds. But when it's outside the womb, like with endometriosis, the blood can't leave your body. This can cause pain, especially during her periods. Some girls might not feel much pain, while others might have a lot. It can also make it harder for some women to have babies later in life. What is the pathophysiology? How does it happen? Endometriosis is a complex and often enigmatic condition, and its exact causes are not fully understood. However, several theories and factors have been proposed to explain its development. Here are 7 potential mechanisms. Retrograde menstruation. This is the most widely accepted theory. It suggests that during menstruation, some of the menstrual blood and endometrial cells flow backward through the fallopian tubes into the pelvic cavity instead of leaving the body. These endometrial cells then implant on other pelvic organs and grow. Now, growing is not the problem. Imagine the kind of pain ladies go through during their periods with just one uterus. Now imagine when these tissues implant and grow in the ovaries, vagina, cervix, rectum, bladder, and even in rare cases have been confirmed to grow in the lungs, brain and nasal mucosa. That is like 2 times to 10 times the normal period pain depending on how many places it grows. See how and why. Implantation and growth. Once the endometrial-like cells implant on pelvic organs, they grow and thicken in response to menstrual cycle hormones, just as they would inside the uterus. Inflammation and cytokine release. The ectopic endometrial tissue, unable to exit the body, becomes inflamed and irritated during menstruation. This leads to the release of cytokines and other inflammatory mediators, contributing to the formation of scar tissue, adhesions, and pain. Angiogenesis and nerve growth. The ectopic tissue develops its own blood supply, angiogenesis, and nerve fibers, which may contribute to the pain associated with endometriosis. Hormonal sensitivity. Like normal endometrial tissue, the ectopic tissue is sensitive to estrogen, which stimulates its growth and proliferation. This is why endometriosis tends to regress after menopause when estrogen levels decrease. Other ways this can happen is by coulombic metaplasia. This theory posits that certain cells in the pelvic and abdominal cavity have the potential to transform into endometrial-like cells, possibly triggered by hormonal or immune factors. Or embryonic cell transformation, where hormones such as estrogen may transform embryonic cells, cells in the earliest stages of development, into endometrial cell implants during puberty. And even surgical scar implantation. After surgeries like a hysterectomy or C-section, endometrial cells may attach to the surgical incision. And in some cases, endometrial cell transport. The blood vessels or lymphatic system might transport endometrial cells to other parts of the body. Immune system disorders. A compromised immune system may be unable to recognize and destroy endometrial-like tissue growing outside the uterus. Hormonal factors. The condition is estrogen dependent. High levels of estrogen, or an imbalance in the hormonal environment, might contribute to the development of endometriosis. Causes and risk factors of endometriosis. Endometriosis is influenced by a combination of genetic, physiological, and environmental factors. Here are 10 risk factors that may increase the likelihood of developing endometriosis. Family history. Women with close relatives, like a mother or sister, who have endometriosis are at a higher risk, suggesting a genetic predisposition. Menstrual factors. Longer menstrual cycles, heavy menstrual periods, and shorter cycle lengths can increase the risk. This is due to more frequent exposure of the pelvic cavity to menstrual debris. Early menarche. Starting menstruation at an early age, before 11 years old, is associated with a higher risk of developing endometriosis. Delayed childbearing. Women who have their first pregnancy later in life may have a higher risk, possibly due to prolonged exposure to menstruation without the interruption of pregnancy. So it is advisable to start giving birth between 20 to 30 years of age. Uterine anomalies. Abnormalities in the structure of the uterus, like a bicornuate uterus, may contribute to conditions like retrograde menstruation, increasing the risk. Low body mass index, BMI. A lower BMI has been associated with an increased risk of endometriosis, although the reasons for this relationship are not entirely clear. Immune system disorders. A compromised or dysfunctional immune system might fail to eliminate ectopic endometrial cells. Environmental exposures. Exposure to certain environmental pollutants, like dioxins and polychlorinated biphenyls, PCBs, has been suggested as a risk factor. Ethnicity. Some studies have found variations in the prevalence of endometriosis among different ethnic groups, indicating potential genetic or environmental influences. Alcohol and caffeine consumption. There is some evidence to suggest that consumption of alcohol and caffeine may increase the risk of developing endometriosis, although this is still a subject of research. It's important to note that having one or more of these risk factors does not mean a person will definitely develop endometriosis. These factors can increase the likelihood, but the exact cause of endometriosis in any individual is often the result of multiple interacting factors. What are the symptoms of endometriosis? Endometriosis can present a range of symptoms, which vary widely in severity and impact. Here are 10 common symptoms associated with endometriosis. Dysmenorrhea, painful periods, one of the most common symptoms. Pain may start before the period and extend several days into it. The pain can be cramping, throbbing, or sharp in nature. From my explanation earlier, you should understand how this happens. Chronic pelvic pain. This is not limited to menstrual periods. Women with endometriosis may experience ongoing pain in the pelvic region, which can be exacerbated during menstruation. In other words, there is almost constant pain. Dyspareunia, pain during intercourse. Pain during or after sexual intercourse is a common symptom, often described as deep pain, and can vary depending on the location of endometrial tissue. Infertility. Endometriosis can affect fertility, making it difficult for some women to conceive. It is often diagnosed in women seeking treatment for infertility. Menstrual irregularities. Heavy menstrual periods, menorrhagia, or bleeding between periods, intermenstrual bleeding, can be symptoms of endometriosis. Pain with bowel movements or urination. Women may experience increased pain during bowel movements or urination, especially during menstrual periods, due to endometrial tissue near the bladder or bowel. Gastrointestinal symptoms. These can include diarrhea, constipation, bloating, or nausea, particularly during menstrual periods. Fatigue. Many women with endometriosis experience chronic fatigue, which can be debilitating. This symptom is not fully understood but may be related to chronic pain and inflammation. Back and leg pain. Endometriosis can cause nerve irritation, leading to back pain or leg pain, which might worsen during menstrual cycles. Other extragenital symptoms. In rare cases where endometriosis affects areas outside the pelvis, symptoms may include chest pain, coughing blood, if the lungs are involved, or headaches and seizures, if the brain is involved. Many women develop mental disorders because of the pain. The severity of endometriosis symptoms does not necessarily correlate with the extent of the endometrial growth. Some women with extensive endometriosis might have mild symptoms, while others with a smaller amount of tissue can have severe symptoms. Diagnosis and management are crucial for improving the quality of life for those affected. What are the possible complications? The complications include but are not limited by these. Infertility, perhaps the most well-known complication. Endometriosis can lead to infertility in some women, possibly due to inflammation and scarring that affects the ovaries and fallopian tubes, as well as the quality of the eggs. This affects the release of eggs or even growth and maturation of eggs, which is how infertility happens. Ovarian cysts, endometriomas. Endometriosis can cause cysts to form on the ovaries, known as endometriomas or chocolate cysts. These cysts can grow and sometimes rupture, causing severe pain. Adhesions and scar tissue. The inflammation caused by endometriosis can lead to the formation of fibrous scar tissue, adhesions, that can bind organs together. This can cause pain and affect the function of involved organs. Chronic pain. Persistent, chronic pelvic pain can occur, impacting daily activities and quality of life. This pain can be exacerbated during menstrual periods. Bowel and urinary disorders. When endometriosis affects the bowel or bladder, it can cause symptoms such as painful bowel movements, diarrhea, constipation, and urinary urgency or frequency. Increased cancer risk. Although rare, there is a slightly increased risk of certain types of cancer, including ovarian cancer, in women with endometriosis. Intestinal and ureteral blockage. In severe cases, endometriosis can cause blockage or obstruction of the bowel or ureters, the tubes connecting the kidneys to the bladder, which can lead to serious complications and may require surgical intervention. Pain during sexual intercourse. Endometriosis can make sexual intercourse painful, dyspareunia, which can affect relationships and emotional well-being. Impaired quality of life. The chronic nature of the pain and other symptoms associated with endometriosis can lead to decreased quality of life, including impacts on mental health, social life, and employment. Mental health impact. Chronic pain and fertility issues associated with endometriosis can contribute to mental health challenges, including depression and anxiety. It's important to note that not everyone with endometriosis will experience these complications, and the severity can vary widely. Early diagnosis and effective management are key to reducing the risk of complications and improving the overall quality of life for those affected by endometriosis. That brings us to the end of this video. In my next video about endometriosis, I will explain how the symptoms differ from other pelvic inflammatory diseases, diagnostic process, medical and alternative treatments, foods that aggravate it, and foods that help with managing the symptoms or endometriosis diet. Thank you for watching my video. Do not forget to like and subscribe to this channel, and don't forget to ring the notification bell to be notified when the next video on this is out. For the ladies going through this very painful process, I want you to know that it is not the end of the road. I can't even begin to imagine what you are going through, but everything will be alright. Take your treatment seriously, and if you don't have endometriosis yet and you start experiencing any of these symptoms, don't be shy. Go to your gynecologist and get tested before it gets worse. I wish you all a very healthy and beautiful life. See you in my next video. Bye for now.